So one thing that we've talked about is how this has been sort of a typical presentation. Can you speak about, David, about what this clinical presentation of this would look like? And just to give a thought to our clinicians who are listening, or even patients who may be interested in finding the symptoms, what does monkeypox usually look like, and what are we seeing now?
Well, I mean, usually it starts out with a prodrome of fever, sort of muscle aches, body aches, maybe headache, and then a rash develops, and the rash is usually synchronous. That is, all sort of the lesions are following the same timeline, which is different from chickenpox, where there may be some lesions that are just starting and others that are crusting over. I think the difference is that a lot of people are seeing a rash more prominent in the sort of lower abdomen groin area. And that is a little bit different from having a widespread rash, but this is a rash that you can get on the palms and soles, and that's a fairly characteristic thing. But eventually the rash progresses from a little papule to a pustule, and really is some of the pustules can be relatively large and look fairly different from chickenpox, although clearly chickenpox is one of the major diseases in the differential.
Yeah, so for people who might be wondering what this rash looks like, is generally the kind of rash that you might see similar to what people may see, but slightly different than chickenpox and herpes? Would that be fair to say, that this would be lesions that were fluid-filled, the rash that they would see?
Fluid-filled and sort of almost like a milky-looking fluid, and potentially a little bit larger than you might see with chickenpox or herpes lesion. And
is that what we're currently seeing as well in many of the patients?
In some of the patients, yes, but some are having sort of smaller lesions, some that have crusted over. I mean, because some are presenting late, they're being missed. The diagnosis is not being made because clinicians aren't thinking about it. I mean, honestly, if you look at the first case in the U.S., the clinicians were agonizing over what this disease was, and they'd done lots of tests, and then suddenly they read about monkeypox elsewhere, and they said, that's it. So it is presenting in an atypical manner in some of the individuals who have had it.